Nidana. The causative factors that are responsible for producing the Kampavata are as follows: intake of Ruksha, Shita, Alpa, and Lagu Anna, which means excessive intake of dry, cold, less, and light food. Langana, excessive fasting. Vega Sandarana, suppression of natural urges. Ati Vyayama, excessive exercise. Ati Cheshta, excessive physical activity. Ati Adva, excessive walking. Plavana, excessive swimming. Divasvapna, sleeping during the daytime. Ati Prajagara, keeping awake during night for longer duration. Ati Vyavaya, indulging in sexual activity excessively. Abhigata, trauma. Chinta, excessive worry. Shoka, excessive grief. Bhaya, excessive fear. As Vata aggravates naturally at the later part of life, so we come across this condition predominantly in the old age, and also the above said Nidanas will contribute in the manifestation of Kampavata. Similarities between Kampavata and Parkinson's disease. Firstly, Kampavata. It is one among 80 Nanatmaja Vatavyadi. As the word itself says, Kampa means tremors and Vata is the one among Tridosha which becomes Prakupita and Dushita and is also responsible for producing the Vadi called Kampavata. And also, Kampa is said to be one among the Vata Prakupita Lakshana. There will be pathological increase in Chalaguna of Vata which is caused due to indulgence in Vatakara Ahara and Vihara. Further, this Dushita Vata takes Sthana Samshaya in Majja Dhatu which later cause dysfunction in the brain and thus produces Lakshanas such as Kampa, Stamba and Cheshta Sangha. Aggravation of Vata leads to degenerative changes. All these symptoms which more closely resembles to the Parkinson's disease. Parkinson's disease is defined as chronic, progressive, neurodegenerative disease characterized by both motor and non-motor features. It is also called as shaking palsy. It is caused due to the death of neurons present in the basal ganglia. It presents with the same set of symptoms as that of Kampavata such as tremors, rigidity and bradykinesia. Types of Kampa that are found in Ayurvedic classics are as follows: Kampa, tremors; Vepatu, shaking; Sfurana, repeated and continuous shaking; Spandana, pulsating; Tandavavata, chorea; Akshepaka, clonic convulsions; Apathanaka, repeated convulsions; Dandapathanaka, tonic convulsions; Apasmara, myoclonic seizures; Kafavrita Vyanavata, which means the Vyanavata gets covered by Kapha dosha; Samanavrita Vyanavata, which means the Vyanavata gets covered by Samanavata. Types of involuntary movements. Involuntary movements are the group of abnormal, uncontrolled and unintended movements caused due to some neurological conditions. It is categorized into two types: hypokinetic hypertonic and hyperkinetic hypertonic. Firstly, hypokinetic hypertonic, which means abnormally reduced movements and increased muscle tone. This can be seen in Parkinsonism, which presents bradykinesia, that is, slowness of movements, rigidity, and tremors. Secondly, hyperkinetic hypotonic, which means abnormally increased movements and too less muscle tone. It consists of following: tremors, which means vibrating or trembling; chorea, sudden, irregular, explosive movements; dystonia, abnormal posture; tics, habitual spasmodic contraction of the muscles; myoclonus, brief muscular jerks; Balismus or hemibalismus, which means violent flinging motion of the limbs. Athetosis, worm-like twisting of limb. Dyskinesia, twisting. Fasciculations, twitching of an individual muscle. Akathisia, lip smacking, chewing movements, and tongue protrusion. A 65 years old male patient, not a known case of diabetes mellitus and hypertension, was apparently normal 8 months back. Gradually, he developed an involuntary shaking of his right hand and lower limbs. Initially, he consulted to a local hospital but did not get relieved. So he consulted our hospital for further treatment and was clinically diagnosed as Kampavata. Patient has been treated with oral medications for 10 days respectively.